My name is Michael Holtzman, and I'm the Director of Pulmonary and Critical Care Medicine at Washington University. And on behalf of the Fellowship Training Program and Fellowship Director and my fellow faculty, I wanted to give you all a brief overview, really, of the research aspects of the program, since you've heard, I'm sure, comprehensively already about the clinical and educational aspects. So the piece of the puzzle that I'm going to talk about is depicted here in terms of clinical and translational research and educational work that we do. And as I say, you've probably already gotten a heavy dose of the other aspects of the training program in terms of patient care and particularly clinical faculty. So with that in mind, I want to introduce you to two aspects of the program that are key. First, the clinical research overview of the program, since that's most likely the first aspect of any sort of research experience that you'll encounter. Typically, fellows start, as you're probably well aware, in clinical training and then get their first exposure to the possibility of doing patient-related research. And that activity is covered in our group by the gang that's depicted here. So what I've tried to do is on the left-hand column is show you some of the correlations of research activities that we do based on the types of diseases that we see in our daily practices. And then on the right here, the group of people who are involved in those kinds of activities. And just to capsulize what you're seeing here, not to get into any sort of detail, but just there's a fairly broad spectrum now of research activities in this area, and a fairly significant number of people involved in one or more of those. So I would say that in contrast to many years past, there's a very broad set of possibilities to pursue clinical research, and a fairly rigid and significant and comprehensive pathway in this way to do that, if that's what you choose to do. So in order to do that, and in order to transition some of this work into more basic approaches, we have a group of what I call research type faculty, in contrast to the group you've already heard about in what I would call clinical type faculty. The primary difference being these people spend the majority, that is greater than 50% of their work time is spent in doing either basic or translational research. So what I've done here is listed the people in the group that are involved in that kind of activity. And then on the right, the kinds of areas that they are studying at the present time. And not, again, to get into much of the details, simply to give you a snapshot to suggest that there are a lot of people doing this, both in laboratory and in silico-based activities. And there is a very broad spectrum of lung biology and disease that we cover. So most of the time, if you can think of something that you're interested in, it will be covered somewhere in this group. But if not, we're always adding and subtracting people from this activity. And as I'll show you in a second, bringing other people in to cover even additional aspects of lung biology and disease. So with that in mind, what I wanted to do here is give you, similar to what I showed you for clinical research, sort of the broad areas of translational research that we do. And on the right here, corresponding again to that previous slide, the people that are doing that kind of work. So again, not to get into details, but just to give you a broad stroke for a couple messages. First, there's a relatively broad spectrum of areas that we cover in terms of translational research activity. Listed here just in alphabetical order. It's essentially the entire gamut of lung biology and disease. And then on the right, two things are depicted. First, in the top line, for example, or the initial names here, those are the people based primarily in pulmonary and critical care medicine who are working in these areas. And the tactic that we take in order to develop this much groundwork is to bring other people from other parts of the university into the group to help us cover this. So a simple example of that would be the studies of asthma, where Jeff Haspel, myself, James Krings, Kyle, Kenyon, and Young work within the division on asthma. And then they collaborate with people like Debbie Lanskow, who's in rheumatology, or Gaya Amarasingh, who's in immunology, to bring other skills to this and thereby form a more comprehensive team and a more comprehensive approach to the problem, which translates, of course, into not only better research, but also better training if somebody's engaged in that kind of activity. And that theme carries out throughout the whole list here, where you have people based in our group, and then other people who we bribe essentially to help us work on lung disease. And as I say, that translates into a much more comprehensive, broader, deeper experience, not only for the project and the scientists in the project, but of course for trainees who join the project, which is a huge advantage, I think, over some other programs. A couple last points. One is just that we do our best to avoid the frustrations of research by providing a set of cores to support not only the scientific group, but also trainees. And just briefly, again, here, those cores are listed here on the left with the people who are involved on the right, starting from administration, going down to statistics. And so the idea here is to get trainees up and running quickly, to hopefully avoid some of the frustrating aspects of research in the early stages of getting methodology in place. So instead, you can jump that step to at least to a certain extent and call on these people to help you grind through the kinds of issues they're interested in, and thereby get original data much quicker, more efficiently, and with significantly less frustration that you might otherwise have. And we try to do our best here in covering both brand new state-of-the-art techniques, for example, single cell RNA sequence analysis, not so new anymore, but a relatively new approach that we've developed within the group and with extended collaborations, all the way to some simple things like just, morphology, where we're just getting tissue and putting it in the freezer and waiting for someone to use it. So there's a fair amount of coverage here. And similarly, we're always interested in bringing in new techniques if trainees think that's useful. So just a couple words, and then I'll be done here, on the formal training, the underpinnings for the formal training program. As you might know, most of these higher echelon universities have what's known as an NIH T32 training grant. Ours has been in existence now for about 40 years, and it's essentially set up to support a formal, rigorous program in research, either basic, translational, educational. Any substrate is okay, but the idea is to create a more formal curriculum so that fellows get an experience that I would call similar to a graduate student. In fact, there are graduate students enrolled in the same program as well as the fellowship program. So just 2 slides. First, just to give you an idea that the program, as I say, an NIH T32 program entitled Principles in Pulmonary Research. Again, not to get in the details, but just to show you that that program is embedded within many other support services at the university. Interdepartmental programs, other departments that have similar activities, a series of advisory committees, internal and external, including committees that supervise directly the individual fellows. All of that feeds into the trainees' experience in the hopes of getting a very broad, comprehensive experience that takes advantage of the entire university instead of just the pulmonary program itself. And the other thing to mention is that it has built into it a mentorship aspect that, again, quite similar to the graduate program, if you will. We've divided it up into 3 tracks just for simplicity in terms of choosing a mentor and understanding how the mentorship works, namely immunology, epithelial biology, and a translational track, as well as some support faculty. And within those tracks, we also have what we call senior mentors. So guys who have been around the block and can serve as a primary mentor, often with their own NIH funding experience that can help guide you. And then junior mentors in training who are just beginning the pathway, to fully establishing themselves as a researcher, but does two things. First of all, it gets you some closer peer experiences, I would say, at the level that you're trying to make progress. And secondly, grooms these people for eventual roles as senior mentors that can do the job on their own, if that happens to be the case. And then we have a whole number of people in a support role, primarily designed to complement the skills of these people, but often to bring new techniques and technologies that sometimes they run for the school and might be relevant to your project. So having people like that on board, for example, if you were really interested in two-photon microscopy, you could bring Mark Miller into the project and incorporate that into your research approach. So just want to leave you with the idea that it's a fairly large group, about 75 people at the moment, but for whatever reason, we always seem to add a couple every year. So if you come along and say, in spite of all these people, there's nobody really here that you want to work with or that you think will help you to get to the goal line, we're very flexible about adding on. In fact, we encourage fellows to look for other people to bring new skills into the group and to use them to expand what we do. So to sum up, hopefully that's giving you an overview of what we're doing. I just want to emphasize that it's a relatively formal pathway. We take a fairly premeditated approach to trainees to be sure that they don't fall off the rails in any significant way. And so it's a fairly rigorous program, but it's designed to adapt to fellowship needs in terms of whether people want to do clinical research, translational research, basic research, or even more recently fall into an educational pathway, which is being prioritized in the school as we speak. So the point of this really bottom line is that we are trying our best to make sure every fellow gets a maximal experience and try to taper and tailor some of these programs to their needs. And with that, I will conclude and thank you for your attention.